Hi, guys. I have a PSA. I find that I am finding some horrible patterns with some of the payers in America. And I want to quickly warn you guys about it. So if you guys look at if you're worried about your drop in income and you just don't understand why you're not making any money and no revenue for your revenue cycle management, and you don't really see anything abnormal, you just know that like the AR is trash, the money is not coming in, and the doctors are getting upset. You're either a doctor thinking about going back to a hospital because you can't afford to practice, or you're a group that hired a bunch of doctors and now you can't really pay them the way they need to be paid, and they're probably going to leave your group. um, Check out your denial codes. So run a report. I don't care if you're the CEO of a big hospital in America, a private practice somewhere in small town America, a medical biller, a coder, whatever. I want you to go into whatever system you're using and run your denial codes or your reason codes. And if you see CO45 denial code, I'm hoping you're looking at the screen because I'm sharing the screen. A 45 denial code is like, let's say you do a surgery and you charge $30,000 for the surgery. And then you and the payer have agreed in your contract to, based on whatever the payer agreement is, you pay 80% or you pay 70%, and then the patient pays 20% of the co-insurance, whatever. It's your agreement. And so the CO 45 denial will look something like this. You charge $30,000. We agreed to pay $10,000 as some made up insurance company, Green Card Health Insurance. We paid you $10,000. We then wrote off $15,000. That's the CO 45 denial. $15,000 of that claim is written off as a agreed adjustment. We agreed that you can charge, but we're not going to pay. $5,000 that's left went to patient responsibility. That is it. So when your system, your EHR or your billers get that EOB, nothing triggers anything. It's like, this is the agreement. We write that off. We just write it off because we agreed with it. However, what I have noticed with some of my clients is the CO45 denial is denying 100%. So what that means is that practices who have high volumes, a lot of their money is just getting denied, but it isn't getting a denial code saying, out of network or, this isn't a covered benefit. It's getting a CO45 denial. So it's not triggering in your system. So you're losing, depending on how big you are, hundreds, thousands, maybe even millions of dollars a year, because they're utilizing the CO45 denial to deny it, write it off as an adjustment, and then it doesn't trigger your EHR. So you don't even really know where to start. So what you're now going to be focused on is the denials that are coming in for actual denials, and you're going to be fighting that. All the while, your revenue is going to drop, and you don't really know what's happening. So check out your report codes, your denial codes, your CO45s, all your codes. Run the report. Look at CO45 and look at how much money you're losing, and then go back in manually and look at that EOB and decide and check and see if you're getting scammed. Now, let me tell you guys something. I have been preaching from the Jaded Medical Biller forever and forever. The payers are not your friends. I have to deal with people who hire me, who ask me for help, who want me to do what is normally traditional in this industry, to just like go around in a nonsensical circle while everybody loses money. And I just am not interested in it. I am interested in the cause, and it will always start with the payer. I don't care what you say. It will start with the payer. So I'm going to take you to my LinkedIn page, and I'm just going to show you. Let's go on ahead in here. I put in algorithms, and then I just said Optum. Okay. Senior data analyst, whatever. Tennessee. I'm mostly in Nashville, but for some reason I pulled up this one. Anyways, when you look at the description, let me move all this down, of what they're doing, can you create complex? SQL algorithms using multiple data sets to stage or present information in a meaningful way that supports business stakeholders. They design an algorithm that hits you in your weaknesses. If you do not have the eyes on these types of things, they're going to get you. They're going to get you. If they know your people do not put in the information, they can send you an additional information request, and they say, we'll give you 14 days to do it, 30 days to do it, 60 days to do it. But they know, based on the experience and the history of your practice, that you rarely get it in on time. They're going to hit every claim, whether or not you've agreed to it in your contract, whether it's a paid service in your contract. They're going to hit you with that claim because they're going to siphon off thousands of dollars from you because they know you're not going to get the information in quick enough, right? That's an algorithm. That's what they're asking for people to do. They're asking for people to analyze this types of data, and then they're going to figure out an algorithm to hit you in your pocket every time, every time. And if you're also not looking at the CO45s, which many of you are not looking at the CO45s because you got so much to do, it is slick. You're going to lose millions of dollars. And in my opinion, it's fraud. Now, many people can say, oh, that's your opinion. No, that's just business, whatever. I don't know. It's in my opinion. I might be wrong. Okay. In my opinion, that's fraudulent, because if we sign a contract and you agree to pay for the services that I perform, and we agree on a percentage base, and then you go back and you CO45 all my stuff, that's fraudulent. So I'm asking you guys, I don't know if you guys are dealing with this, but let me tell you, I don't care if you're making $50 million a year at the Mayo Clinic, which is probably way more than that, or you're making $150,000 as a private practitioner. I need you to get into those reports. I need you to look at all your EOBs. I need you to look at the denial codes and then match those denial codes with your contract. You must understand your contract. And how do you get past that? Well, you need to start utilizing your system. You need to start mapping your system. You need to start setting rules in your system. I don't care what system you're using, McKesson or Epic or Advanced MD or Cario. You need to get in and understand how to utilize your system and map it so that you can combat the algorithms that are being designed and people are getting paid good money to not pay you. They're paying people good money to figure out ways not to pay you, is what I'm saying. So that is crazy. So what I have been seeing with people that I work with is that covered expenses are coming back as a CO45 at zero payment. So where it should have been $60 or $100, and then maybe the payer wrote off $75 of the CO45 agreement, the adjustment, they're writing off 100%, but because it's coming back to your system as a CO45, it's not popping up on your end as a denial. So you're losing money and you don't really know where you're losing it from. Now, some of you guys may be super advanced RCM, revenue cycle managers, and you're like, oh no, I would have checked that. But the majority of you guys will not check that. And they know it. And there are so many ways for them to get you with their algorithms, and most of it is based on your habits. So if you're having a hard time with your records requests, if you're not checking your CO45s or your denial codes, if you're not looking at your authorizations properly and asking the proper questions for your authorizations, these algorithms that the payers, i.e. Cigna, Aetna, United Healthcare, all the big guys, even the small ones, they're creating algorithms to learn your patterns and to learn your weaknesses. And then they keep hitting you over and over and over again with these problems. So when I go into one of my clients' jobs or practices, the first thing I look is at the denial codes. I look at the reason codes, and I will walk the reason codes back into time all the way to intake, because I realize I'm not dealing with a department that might be untrained, which a lot of medical billing departments are untrained. I'm dealing with a sophisticated algorithm that, unless you know it's there and it's working against you, you're going to miss it. And you're always going to find yourself firing, getting frustrated, hiring new people, switching out your revenue cycle managers, losing doctors, gaining doctors, pulling your hair out, when really you need to be focused on the algorithm that the payers are inflicting on your practice. This is a PSA, guys. This is going to be a short video. I'm going to post it on LinkedIn so I can get to the most Most of you guys, I hope you guys take my advice and really look at your reports, because in the reports you will find the answers and the problems. And it made me so mad when I saw this. It made me so mad. And so here's let me show you an example of an EHR or an EOB. I just looked this up online. This is an example. And as you can see, the patient isn't real. I don't even know if there's a patient name on it. It's just a Turner Timmy. Okay, so it's not a real patient. It's an example. I found it on Google. This is what it would look like. This is the patient's name, Turner Timmy. And then Turner Timmy saw a doctor and had a procedure, and the doctor charged $266. So your agreement with the insurance company and your contract states that you will get paid $100 for it. And the patient will pay a $50 deductible. Okay. And so once the patient pays his deductible and the insurance, you're going to get $100. You're getting paid from the insurance company $50 because they're saying you should have collected the $50 from the patient at the time of check-in. And then with our payment, you got $100 for that service. That's our agreement. On the CO45, we wrote off $166. So you charged $266. You and I on our contract only agreed to $100. Okay. That's including what the patient's going to pay at $50. So we gave you a check for $50. The patient gave you a check for $50, and you got $120. You got $100 total, and then we wrote off $166 because that is our agreement. We agreed to write that off, and you're like, oh, wonderful. And it's the same thing here. It's like, and so that's what you got for me. That's how it's supposed to look. But instead, you're charging $266. They're coming back at zero, maybe whatever the patient deductible is, and then the provider payment is $0. And then they come down here on the CO45 and it will say minus, let's say $50, right? They'll say we wrote off $216, and the patient paid $50 and we wrote off $216. That's not according to you. That's not proper, but that will not trigger on your report. So you will see that on your report as a CO45. You won't even look at the numbers. You won't even look at the breakdown. So you guys have to be much more astute. I don't know what's the word, much more aware of this type of trickery that the payers are handling for you. And if you guys find it, I suggest you call a lawyer like this and figure out if there's a class action and get on it immediately. And then, but also tell the insurance company you're onto them and make them back pay all of that. Make them back pay. But you cannot let these people get away with this. This is a big problem. Look at your denial codes, compare it against the EOBs and compare it against your contract. And if you find it, let them know you want all your money back, and then also call a lawyer. I don't know these people. I just looked it up because I was looking up class action lawsuits for insurance payers, and they're getting hit all the time because they're always doing this type of stuff. And many of you guys will not even investigate enough to figure out you're eligible for class actions. So I don't know who these people are. It's not sponsored, whatever. I just put class actions, insurance payers, they popped up. But that's what I want you to do in those orders. Run your reason reports, take a look at the EOBs, compare the EOBs against your contract, and then call the insurance payers and tell them to give you back your money because they are doing something illegal or unethical. I don't know if it's illegal or not. And then call a lawyer. Those are your first 4 steps. Do it in that order. Okay. No mercy. No mercy. And of course, all of this is my opinion. Of course, you know, I'm not saying that any of it is illegal. Obviously, it's not illegal or they wouldn't have done it. I definitely think it's unethical. I definitely believe it's fraudulent. That's my belief. How is it not fraudulent that you would have a signed contract and then you would go and do something like that? That's what I'm seeing with the people that I'm working with. However, take it to your legal departments, take it to your revenue cycle management departments, your executive team, which a lot of times I get it, guys. I get it as a biller. The executive teams are very frustrating because They will not, they want to figure out a problem other than the problem. They go all around. They got 700 meetings a month messing with you, and you're in the trenches really trying to make the money, and they're not listening to anything you're saying. Try and present this information to them when you find it, and then they might decide to be a great executive team, depending on what type of company you work for. And then really look into a class action, joining one or calling a lawyer and showing them what you found and seeing if they think it's a big enough case, and then starting one. But you guys have to start getting your money back by any means necessary. You guys can do all the right things. And if you've got an algorithm really fighting you, a computer fighting a human, a team of humans, you're going to lose all the time. You really have to you have to start getting aggressive, and you have to start getting smart